at Aviva Dentistry, I've developed my skills, so I'm able to produce veneers in a day. So you come to see me today because you're thinking about getting these two side teeth sorted out.
Yeah.
We've taken some pictures of you already, but this is sort of the time when we need to have a discussion about what the possible treatments are for you, what the best treatment is for you. This is an amazing process. It's been around since about 1985. A guy called Prof. Mormon was the one who first developed it. And I've been involved with it since about 2003. And I lecture on it throughout the world. And my main passion really is using it for anterior teeth, for front teeth, for smile teeth. Within the UK, I'm Vice President of the British Academy of Cosmetic Dentistry, and we have an accreditation process, and that means that we have to pass exams to show our peers that actually our dentistry does look good, that it's not just a generic picture that's been put onto my website. So it's important that you have a dentist who is correctly trained. You've done some research, you've done a little bit of research on the internet and...
Yeah, well, I've shopped around and had a little look, and I came across you, and you came very highly recommended, so I thought I'd come in and just have a chat really.
Great. So, I mean, this your situation is you had some orthodontics, I believe, as a child. You had your teeth moved around.
Yeah, I did indeed.
And that's great because it means that we have your teeth in a good position, relatively speaking.
I'm not happy with the way that they look. I don't feel like I'm able to smile.
Yeah.
I don't feel particularly confident.
That's really important. Okay, so I'm going to lie you back, I'm going to get you the thumbs up, and off we go.
Okay, thank you.
You can smile in a fraction of a time, in an hour or so we'll be done. So my tips for veneers, for how you choose a dentist to give you veneers. One, I would say, is obviously carefully research the dentist you're thinking about treating you. We have many patients who contemplate about going abroad. There are some dentists abroad who are good at veneers, but there are some who aren't, and you need to think, one, why is it cheaper? Are the materials as good that have been used abroad that are going to be used by a dentist in the UK? And the type of training that the dentist has had. And the process involves basically using a camera, a special camera, which shines blue light onto the tooth. And that blue light is reflected back into the camera, and that produces a 3D image on a computer screen. This will then allow me to design the veneer or the crown or whatever I've decided to design on the tooth to give that tooth its correct shape. The process then goes on to a milling stage. Once I've designed it, I choose a colour for the patient's teeth, which often have multiple colours in that porcelain block. And this porcelain block is put into a milling machine. It mills it out of the block and then produces this amazingly beautiful veneer or crown. The fit of them are exquisite. They fit perfectly, around about between 20 and 40 micron fit, which is incredibly accurate. We don't have any distortion from our impression. Once we have the restoration back, I then will stain and glaze that restoration to really give a bespoke crown for the patient or veneer for the patient. It is then put into an oven and baked, just like you would do with pottery. This gives a very, very strong end restoration. Okay, so here we go. I hope you've already seen the colour, but this is the final here.
Wow. Alright. Thank you so much.
It's lovely. It's lovely.